I have with me here today Dr. Leslie Farmer, and she's the medical director of our VA Northern California Women's Veterans Healthcare Program. And she's going to tell us about some upcoming events that they've got planned for women veterans and how they can participate even in a virtual fashion. And so let me start, Dr. Farmer, first of all, thank you for joining me today.
Thank you.
And tell the audience, what is exactly you do here? How long have you worked for the VA?
So I've been a physician here since about 2008. I've been here for about 15 years. And then I took over the Women's Health Medical Director position about 5 years ago.
What are some of these upcoming events for women veterans?
April is the Military Sexual Trauma Awareness Month, and we just had a very important event recently. It occurred on April 7th, and we had this event with CalVet and some other community resources. And it was excellent. We had an excellent event. And upcoming, moving forward here in the next month in May, we are going to have a virtual paint night. And this is a paint therapy VVC night, and this is actually going to be our first evening event. So it's going to be kind of interesting to see what happens. On May 14th, we have a post 9/11 resource fair. We're actually presenting, Women's Health is presenting along with the transition team for the 9/11 resources there. May 20th is one of my favorite days. This is going to be our Mother's Day family event. Now, we've had these every year in the past, but recently we've made it more of a virtual event. And once again, we're going to have fun and game and prizes, raffles, and we're also going to have a cooking show. It's going to be for both moms and kids, so it's going to be a great event. And then on May 24th, we are rolling out some information at the San Francisco airport. And these are going to be 3 large displays. Northern California is working with the San Francisco VA as well as the Palo Alto VA, and we're going to get the word out about all the wonderful services that the VA has to provide our women veteran here. We're very excited. This has been a long time coming, and I think this is really going to be a wonderful way to reach out to these ladies coming through the airport. And then in June, we do have a focus group. We're going to be working on the rural community for end harassment issues.
Well, that's fantastic. And you mentioned there's a lot of events for women veterans, and you just listed off a whole host of them. I'm actually really excited about that visual display at the airport and bringing some awareness and hopefully some additional female veterans that'll come and use VA services as a result of that. So painting night, and I've seen the baby showers in the past, and just a lot of services. And it makes some of us non-women veterans jealous of all the activities that are available. But it's important to make sure we're welcoming and that we're meeting the specific needs of female veterans. How has the pandemic changed the way we're caring for women veterans? We
are still providing excellent care to our female veteran. We provide a safe environment, both in face-to-face and virtually. We've just shifted things around a little bit. As for our outreach programs, we had some bumps in the very beginning, but this last one that we had here in April in the MST event, we had over 100 participants. So each time we're getting better and better at our method and getting the link set up, and we're doing a great job. We've also shifted our yoga, our Tai Chi, and our meditation groups virtually. And so people can zoom in and do meditation and yoga virtually. And every week, Rebecca Stallworth runs a women veteran support call-in. And so that's another very important resource that they have as well.
Yeah, that's great. In many ways, the virtual connectivity and everybody learning how to use Zoom or Teams or whatever a version from their home has actually increased outreach because more people can participate. You don't have to drive to and from if geographically you live a long way away. So that's actually been, it sounds like, beneficial to our women's health program.
Absolutely. We have a very large rural community, And you're exactly right. We're able to tap into those folks easily now.
That's great. So what are the challenges in reaching women veterans during the global pandemic, and what are we doing to try and overcome some of those challenges?
We've just had to really think on our feet and fine-tune things. And I think that, time after time, we've really demonstrated that we've been able to think ahead of the challenges, and we have a very robust group of people in the women's health group, and we have meetings regularly, and we try to fine-tune our events and our programs and policies. We're I think kind of ahead of the curve in that way.
Well, it's really important work, and obviously, as you know, women veterans is the fastest growing segment of our veteran population. New veterans that are coming into the system, and that's why some of these events like the post 9/11 group that you mentioned earlier are so important. If folks watching the video, your fellow colleagues and employees here at VA Northern California, or any of our women veterans out there that are getting some information, if they wanted to know, how do I learn about all the events that are happening? I couldn't write down as fast as Dr. Farmer was talking. What's the best way to find out about what's happening?
So here, if you're an employee and you'd like to get some information, going onto the intranet under Women's Health is the best way to do it. And certainly there is our Northern California VA website under Women's Health.
Great. So those links that you can see on the video right now are the best ways to do that and to stay informed. Dr. Farmer, thank you so much for spending a few moments with me today, answering questions and informing folks about some of these great events that are coming up and some of the things that we're doing differently, better, and overcoming challenges in delivery of healthcare to women's veterans. So thank you.
My pleasure. It's just a joy. Thank you.
Well, I want to remind folks that we have changed our rules about COVID vaccines under the Save Lives Act here at VA Northern California. So today, all veterans, all spouses of veterans, caregivers of veterans, CHAMP VA patients are all eligible to come get a COVID vaccine at the VA. And so we are encouraging appointments, but we're working very hard to actually accept walk-ins, particularly at some of our major sites, so that we can continue to progress. As of today, we vaccinated 46% of our patient population and the 88% of our staff. So that's actually ahead of the U.S. Numbers in those categories. And so we're doing a great job getting vaccine out, but we're not at the finish line yet. And we've actually not only now have the charge for all of our eligible enrolled patients, but a broader population of folks that we get to participate in making that difference. And so hopefully you're aware of that already. And are encouraging veterans, and we'll do our best to improve that communication. So that's all I've got for you this week. Have a great week, and I look forward to talking to you again soon.